In my ideal neighborhood of the future, nurses form integral parts of the community. And where they are working in the estates, they are being recognized by patients and residents, where they can stop, greet, and chat with each other. I'm Dr. Lim Su Fee. I'm an advanced practice nurse in Rehabilitation and Community Nursing at the Singapore General Hospital. I have been in nursing for 30 years and I love my job. The advanced practice nurse role epitomises the expansion, evolution and progression of nursing in Singapore. Previously, nurses have always been identified as assistants to the physicians. But right now, advanced practice nurses can examine and diagnose patients, order tests, initiate and evaluate treatment, and now even prescribe medication. We are also able to lead in the clinical programs, conduct research, teach at academic institutions. So I think that the role has evolved from being more of an assistant to now a collaborative partner in healthcare. To be an APN, one has to have the ability to work independently, innovate, and have good clinical reasoning and decision-making skills. The person also has to be resilient and determined. The aim of the community nursing program is to ensure that there is a timely intervention to keep our population well, to delay the progression of frailty, and to avert avoidable hospital admissions with home care, as well as to conduct advanced care planning where appropriate. Our community nurses are sited within the senior activity centers, CCs, RCs, and also the religious sites. So they conduct health assessment, geriatric assessment, provide chronic disease management, medication management, empower the residents to take care of their health, as well as provide care referral. Challenges are inevitable when we are building something from ground up. So I have to speak with various stakeholders. We have to show them why community nursing is so important. So it is not easy to convince people. For example, often we are being asked, why should we embed nurses in the senior activity center? Why don't people just go and see a doctor? So many people do not understand how vulnerable certain segments of our populations are. They are prone to falls, incorrectly taking their medication, do not understand their condition or treatment, and even forgetting their medical appointments. For instance, we visited an elderly patient at his home and he has got a frequent exacerbation of his health condition. And one of the risk factors that caused his disease to be recurring is because of the pets that he kept. As a parent at home, when he visited the clinic, we can just tell him to remove the pet so that his condition can be well controlled. But when we visited his home, we realized that the pet was his only companion. So we decided to not ask him to remove the pet, but to teach him how to handle the pet's feelings, because that is the only way that keeps him going, that motivates him to live for another day. That's something that he can look forward to. So rehabilitation medicine is not just about disease or physical health. It is also not just about prescribing medication or overseeing treatment. The overall aim is to make sure that we are able to push the person to his full potential, to make them feel connected to their surrounding, to feel comforted and supported, to know that they are being cared for even in difficult times. I love to read all types of books, detective files, solving crimes, and even forensic investigations. And I try to instill this interest in my children. Reading those kind of books is similar to what I do in medicine and nursing. You have a condition, you investigate and find the cause, and try to solve it. There are similarities between being a woman and also in medicine and in nursing. We are good at observation skills, we are able to pick up signs, and we are also good at meticulously managing things. Skillful at nursing babies, tendering to children and elderlies, and perhaps soothing a broken spirit. So I hope that in the future, every resident will have a neighborhood nurse that they can talk to and seek advice from and be their partners in their healthcare journey.